risk factors are a combination of what individuals have or are born with, innate problems, so genetic aspects, as well as a combination as what they're exposed to during their adult life, growing up, etc. So environmental factors and genetic factors. So the factors that we really can't do much about are things that are, within the family genetic history. So just by being a woman and increasing age over 50, women who are over the age of 50 are at increased risk of breast cancer. So there's not much you can do about the aging process, and certainly not much you can do about being a woman or a man. Males can be affected by breast cancer as well. Their family history, so if there's a maternal history of breast cancer, it puts individuals with that family history at a higher risk, especially in the first degree siblings, sisters, a mother with breast cancer. So those persons are 3 times more likely than an individual who does not have a family history of breast cancer. And there's a particular gene which may also run in families called the BRCA gene, which is a breast cancer gene, which if is present, you pretty much can't do much about the presence of this gene. It raises the risk factor for breast cancer significantly, as well as ovarian cancer. For those persons who have been identified as being BRCA positive, there are some risk reduction strategies. There may be the use of medical risk reduction with tamoxifen, that's a drug. And there's also prophylactic mastectomies where you can remove the breasts. In terms of the lifestyle modification, that's where we have more of an impact, and that's where we usually try to do most of the education for women about risk reducing or strategies to risk reduce breast cancer. So the hormones, so we mentioned that 50% of breast cancers are hormone positive, and we know that the effect of estrogen over a long period of time, unopposed exposure to breast tissue is not good. And there are certain factors that we can be adjusted. So for example, women, it is usually encouraged for women to try and have children in their earlier reproductive years. But of course, with the many issues that are facing society, women are now more of the income earners in the family, and therefore are more career oriented, and therefore may put off family and reproductive wishes for later. But we do know that becoming pregnant after the age of 35, usually it's not as protected as getting pregnant earlier on. Breastfeeding is protective, so if you do have children, it is encouraged that you breastfeed your children. Breastfeeding is one of the breaking cycles of the unopposed estrogen exposure to the body. So breastfeeding is good. Breast is best for the child, and it's also good for the mother for reduction of breast cancer. The oral contraceptive pills are hormonal therapy. So we know that persons who are actually actively on hormonal therapy from oral contraceptive pills with the estrogens or progesterones, or hormonal replacement therapy in menopause, the excessive exposure and prolonged exposure, and usually the risk really rises after 10 years or more, but the risk starts to increase after 5 years of use. So hormonal contraceptive agents do increase the risk of breast cancer, and therefore if persons can use other forms of contraception, that may be one of the strategies to reduce their risk. Of course, women will have to make individual choices, and it's not as easy as saying avoid oral contraceptive pills. The density of breasts, so women have dense breasts. Some women have dense breasts, and that in of itself puts women at an increased risk of breast cancer. There's not much you can do about that, but screening, the use of the mammogram and breast ultrasound, starting from the age of 40, serves to allow for early detection. So the earlier that any abnormality is detected, the better. Other lifestyle modifications which are really easy for us to do, so the sedentary lifestyle where you're at work all day, sitting around your desk, not mobile, no exercise, eating late at night and packing on the weight, so that's not good. Obesity is a significant risk factor because the subcutaneous tissue, the fat, can be converted into estrogens, etc., which also stimulate the breast. Smoking, so if at all possible, avoid. And so smoking features through many of the different cancers, not just breast cancer, but smoking also does play a risk factor in breast cancer, and therefore women should avoid smoking if at all possible. Drinking, alcohol consumption, excessive alcohol intake also increases the risk of breast cancer. So those are some of the risk reducing strategies. Ensure that you exercise, keep fit. A lean body weight is better than being obese, avoiding smoking and alcohol use. And if you know that you have a family history of breast cancer, or by chance you have you've been tested and you've been found to have the breast cancer gene, then the screening, which is employed for all women as of the age of 40, is more important for these particular individuals. And again, if there is a breast cancer related gene, breast cancer gene 1 or 2, then prophylactic mastectomy, which is removal of both breasts, is an option, as well as medical reduction strategies with tamoxifen.